Hello, my name is Dr. Lindsay Lear, and I'm one of the doctors here at Ophthalmology Associates of Osborne. We're looking forward to seeing you here in Sewickley in the near future to evaluate your cataracts and meet with a surgeon. Whether you were referred to us by another doctor or you already are a patient of ours, my goal with this video is to prepare you for this upcoming evaluation and help you understand what to expect. Cataract surgery is a very safe, highly successful procedure, and we are delighted to meet with you and help make your experience as pleasant and comfortable as possible. During the upcoming appointments, several things will take place. A lot of very important measurements will be taken of your eyes. You will meet with the surgeon to discuss the stage of your cataracts, your eligibility for surgery, and what surgical options you have. We will also discuss and schedule your surgery date and all of your post-op appointments. So please expect to be in our office for at least 1 to 1.5 hours to complete this entire process. When you come into our office, we will first measure the length, shape, and curvature of your eye. This will also tell us how much astigmatism you have. We do this with special machines that take very quick, painless pictures, and they don't even touch your eyeball itself. Then your vision will be measured, you'll have a glare test, your eyes will be dilated, and you will finally meet with the surgeon. While the surgeon takes a look at your cataracts, he will also be looking for any other eye conditions or reasons that your vision could be impaired. If there are no other issues and cataract surgery is recommended, he will also discuss what your goals are, because cataract surgery is a once-in-a-lifetime chance to leverage what we know about all of your eye measurements and your lifestyle to give you the best visual outcome. I say once in a lifetime because this surgery should correct your cataracts for your entire life. We don't often do a second surgery or replace or exchange the IOL implanted initially unless it's absolutely necessary due to the risks of multiple surgeries. The surgeon's primary objective with cataract surgery is to remove the cataractous cloudy lens in your eye, but we also have this unique opportunity to simultaneously minimize how much you rely on your glasses by incorporating your refractive error or glasses prescription into the IOL implant that's chosen. And I'll talk more about your options and what this IOL is in a little bit. Once you and the surgeon are done speaking, we will schedule your surgery. You'll have a 1 day, 1 week, and 1 month post-op appointment here at the office for your eyes, either both or one eye, depending on if you need surgery in one or both eyes. These post-op appointments are going to be very short. They're just really for us to evaluate the level of inflammation and what your eye pressure is following surgery to make sure your healing is absolutely on track. I've mentioned this term IOL a few times now. IOL stands for intraocular lens, and it refers to the implant. As you can see here, it's tiny, it's the size of my nail, that will replace the cataract in your eye. I found it really useful with my own patients to use this model to briefly go over what exactly a cataract is and how the surgery is done and where that IOL is placed. Not many people know what a cataract is or where it's located in our eyes. So this is an eyeball. Our natural lens that we're born with sits right here, this movable piece behind the colored part of the eye, the iris, and it allows us to look through it like a window, just like we would look through a window in our house to view outside. This window starts to get cloudy over time. It starts out nice and clear, but over time with different factors like age, behaviors, UV light exposure, smoking, our diets, that lens becomes more cloudy and difficult to look through, like this one here. This model illustrates, this is the most common cataract, this yellowing over time. This is an exaggerated version of one, but there are other types of cataracts like this one here, like spokes on a bike that start out in the periphery and eventually make their way to the center where it affects our vision. It's even common to have multiple types of cataracts affecting our vision simultaneously, but no matter what type of cataract or cataracts you have, they are removed the same way during surgery. A small tool is placed inside, off the side of the eye, and goes in and breaks up the lens and removes those cloudy parts, and then a second tool is inserted and implants that clear IOL implant to give you a new clear view of the world that you can see once again. So what IOLs are you eligible for? That's ultimately going to be determined by the surgeon. However, there are 3 main IOL categories that you should know about, and I'll briefly mention here so that when you come in for this appointment, they won't be completely new terms for you. The 3 main IOL categories are standard monofocal, often referred to as just standard IOL, a toric IOL, and a multifocal IOL. I'll start with the first one, monofocal IOL. Almost everyone is eligible for this first type of IOL, and it's fully covered by Medicare and most insurances. It is monofocal, meaning it corrects for only one, or mono, focal length of vision, either your distance or your near up close vision, but not both. You decide which is more important to you. Most people who choose the standard monofocal IOL choose for it to correct their distance vision so that they can drive and watch TV without relying on glasses after surgery, and they're usually okay putting on glasses when they need to use their computer or read small print. There's a few people though, like artists or dentists who most of their hobbies or work is near, who may actually choose a standard monofocal lens that corrects for their near vision, and conversely, put on glasses when they need to drive or see further away. Because these lenses have no focusing capability, they correct for either distance or near, like I said, but not both simultaneously. That's the first one, monofocal. The second type of IOL, the toric IOL, will only be recommended by the surgeon if your eye has a significant amount of astigmatism. If you have a lot of astigmatism, that just means that your eye is more oblong than round or spherical. So a standard monofocal IOL doesn't address this curvature difference. So a toric IOL is the best choice for someone who has significant astigmatism and wants to have clear distance vision without relying on glasses following surgery. Toric IOLs are not covered by insurance entirely, like the monofocal standard IOLs are, because it's considered an elective premium lens. But again, it's a great choice for someone who has significant astigmatism and wants to have clear distance vision without relying on glasses for distance vision following surgery. The final IOL type is a multifocal IOL. This lens is designed to target multiple, hence the multifocal, focal lengths, including distance and near ranges. So this is the best IOL option for someone who wants to maximize their opportunity to rely very little on any type of glasses following their surgery. Most people with multifocal IOLs have great vision for distance as well as correct for most near tasks without using any glasses following surgery. It can also address astigmatism if they have it. Multifocal IOLs are also an elective premium lens not fully covered by Medicare or insurance companies. So choosing the right IOL out of all these three may seem overwhelming because, as I've just explained, they're not all the same. It ultimately comes down to your lifestyle needs and your budget, and of course, what is recommended by the surgeon. For premium lenses, you'll pay an additional out-of-pocket expense around $1,000 to $2,000 per eye, depending on if it's toric or multifocal. The surgeon will consider all of your options, discuss them with you, and help you make the best decision based on your needs and goals. The type of IOL you choose does not change your surgical process or your healing time, and it should last you your lifetime. On that note, I can't forget to remind you something that is so incredibly important when you first get to our office and business related, is that we need your most updated health insurance information. Even if your insurance information has not changed, we still will probably ask to see your insurance card, so please bring it with you. With changes in a new year, open seasons, or just changes in your benefits in general, especially if you're new to our office, we need to have this current information to prevent any delays when scheduling your surgery and ensure you have the best coverage no matter what IOL option you decide to get. As I mentioned before, cataract surgery is a very safe, highly successful procedure, and we are honored to help you through this process and give you the best outcome possible. So please come in relaxed, come in excited about your future vision, and we look forward to seeing you in the office for your appointment soon. Have a wonderful day, and thank you again.